Let us now go to visual diagnosis of the fingers. The topic is spoon-shaped fingers and thin pointed fingers. Spoon-shaped fingers usually indicate a lung pathology, which may be cold phlegm in the lungs, phlegm heat in the lungs, or lung and kidney deficiency. Spoon-shaped fingers are usually seen only in patients suffering from chronic lung diseases such as emphysema, tuberculosis of the lungs, or chronic obstructive pulmonary disease. In some cases, spoon-shaped fingers may also indicate a heart pathology. Here we can see what spoon-shaped fingers look like. For spoon-shaped fingers due to cold phlegm in the lungs, there will be cough with expectoration of white watery sputum. There will be a feeling of cold hands and feet, nausea, vomiting, a feeling of oppression of the chest and epigastrium, dull white complexion, pale urine, pale and swollen tongue with a wet white coating, and a slippery, slow pulse. For spoon-shaped fingers due to phlegm heat in the lungs, there will be hot fingers, barking cough with profuse sticky yellow or green sputum, shortness of breath, wheezing, a feeling of oppression of the chest, a feeling of heat, thirst, insomnia, agitation, red and swollen tongue with a sticky yellow coating, and a slippery rapid pulse. For spoon-shaped fingers due to lung and kidney deficiency, there will be dry cough that is worse in the evening, dry throat and mouth, thin body, breathlessness on exertion, lower back ache, night sweating, dizziness, tinnitus, hardness of hearing, scanty urination, normal colored tongue without coating, and a floating empty pulse. Thin pointed fingers are generally related to the state of the stomach and may indicate cold dampness in the stomach, damp heat in the stomach, or severe deficiency of stomach and spleen-Qi. Here we can see a picture of thin pointed fingers. For thin pointed fingers due to cold dampness in the stomach, there will be pain and distension in the abdomen. The abdomen will feel cold and will be worse with ingestion of cold fluids. There will be a feeling of fullness and pain in the epigastrium with a sticky taste and a sticky white tongue coating with a slippery, slow pulse. Thin pointed fingers due to damp heat in the stomach will have a feeling of fullness and pain of the epigastrium, feeling of heaviness, facial pain, stuffed nose or thick sticky nasal discharge, thirst without a desire to drink, nausea, feeling of heat, dull yellow complexion, sticky taste, and a red tongue with sticky yellow coating with a slippery rapid pulse. For thin pointed fingers due to stomach and spleen-Qi deficiency, there will be poor appetite, slight abdominal distension after eating, tiredness, lassitude, pale complexion, weakness of the limbs, loose stools, uncomfortable feeling in the epigastrium, lack of taste sensation, a pale tongue, and an empty pulse. Thank you so much for your attention.